Let us now give the floor to the next speaker through the internet. This is Mr. Loukidis Stylianos, President of the Greek Lung Society. We have a we mutually esteem each other. Lung medicine is closely connected to cystic fibrosis. We're glad to have you. First of all, good morning to everybody. I apologized for not being able to attend. Today I have to be at the Attikon Hospital. What I had to tell you, well, let me begin by saying, and in the last 2 days, the European Lung Society organized an event on cystic fibrosis in adults. As a director of the scientific program of the European Lung Society, this was a personal bet for me. It was organized in Milan with physical participation and remote participation. Everyone warned me against it. It's not going to be successful, they told me. In the end, there were 300 participants, an excellent discussion. And this shows that scientific information has to become very intensive. Cystic fibrosis is now a disease of adults for a great number of years now, which is great joy for us. The Greek Lung Society continues for the 5th consecutive year to finance from its income a scholarship for the cystic fibrosis ward at Sismanoglio Hospital, not only in order to help Mrs. Diamandea, but in order to help all these people acquire skills for the 2nd consecutive year based on a decision that we made last year, and this is the 2nd year that we've been implementing it. We give a clinical scholarship at the Hospital of Papa Nikolaou in Thessaloniki, and as a testimonial to the intention of the society to have 2 dynamic wards in hospitals, to preserve them. We also took an initiative that we will expand to other agencies and bodies. For adult pneumonologists have received the first letters from our society, and shortly we'll send letters to pediatricians and to the transplant unit. So with the new year, we have received positive answers. We will meet together, and 2014 will be a year dedicated to an effort to look at what will happen with adults with cystic fibrosis, and we will institute a cooperation with the ministry. This is a very important initiative. There are very few members of staff. We need to approach and mainly train people with skills in cystic fibrosis. This is a personal bet, a personal wager. I am a director of the the lung ward for 3 years, and I want to expand these efforts with other bodies and agencies. I wish the best to everybody, lots of health, have a happy holiday, and I think that all these things that we have in mind and we want to put in practice, hopefully they will be implemented for the best of our patients. Thank you very much for the honor of inviting me to take part to this conference. Thank you.
Mr. Loukidis, we really thank you for finding the time to join us today. We know that you are really busy. Congratulations on the conference in Milan, because ultimately cystic fibrosis pertains to many people. And now, as you talked about the adult center, well, this is a very important matter. We, as an association, try to contribute towards this direction because adult units are really understaffed. We have 300 patients and only 1 doctor said there. So you can understand that it is important for the ministry to examine it and to listen to these needs, to reinforce the units, to have specialized pulmonologists that will be supporting us as doctors, and so as for patients to be able to take the care and receive the care that they deserve. So thank you very much, Mr. Loukidis, for your contribution. Thank you. Thank you too.